Moving on to caring for clients with disasters, which is actually chapter 15 in your book. Disasters obviously are threatening events of such destructive magnitude and force as to dislocate people, separate families, damage or destroy homes, and injure or kill people. This is the American Red Cross's definition, of a disaster. Now, there are two types of disaster. We can either have a natural disaster or a human disaster. All right, the disaster cycle has phases. You have the warning phase, the impact phase, emergency phase, and recovery phase. There is information on, page 189 in your book, Client Teaching, 15.1. You need to be sure and know that information regarding what patients need to have, or what you need to educate your patients on when they're preparing for disaster, what to keep in stock. Okay? Now, the three types of human disaster: bombings, biologic, and chemical. So bombing disasters are broken down into radiologic disasters. So we have the dirty bomb, the nuclear power plant, and nuclear blast. All right, we're going to break this down a little bit more. So for radiologic disasters, people, animals, and the environment are exposed to harmful levels of gamma radiation. It penetrates, damages, and destroys the body cells. So different types. We have a dirty bomb, which is the conventional explosive that spreads a small amount of radiation, but also has powder and pellets. So the greatest danger from the dirty bomb explosion itself is from the actual device blowing up, so the pellets that come from it, and the radiation is a secondary danger with that. Then we have nuclear power plant disaster. So if a population is within 10-mile radius of a nuclear power plant, they must have immediate access to what? I know it's listed in your book there, but what they must have is potassium iodide, okay? Potassium iodide protects the thyroid gland from absorbing the radiation. So if there is any population within 10 miles of a nuclear power plant, they must have enough potassium iodide on hand for every person to receive it. They must also provide shelter for the people within that 10-mile radius. Okay? Then we move on to nuclear blast, which is like a fireball from the explosion. So in the nuclear blast, you have intense heat, light, and air pressure, as well as radiation. When the vapor cools and condenses, it drops to the earth, and that's called the fallout. All right, so on page 190, the last paragraph of nuclear blast has some really good information in it you want to be sure and look over. Here are your pictures for radiologic disasters: your nuclear power plant explosion and your nuclear blast with the significant amount of heat that we talked about. Okay. Then we move on to assessment. So assessment of radiologic disasters. We need to assess the patient for the appearance of the burns and trauma. What is not seen should be more worrisome, because that's the radiation that we can't see. All right, the contaminated person can contaminate others. Now, how is this done? They can contaminate others via blood, sweat, urine, feces, so body fluids. So you need to be real cautious about that. Acute radiation syndrome, ARS, it may be deadly in as little as 10 hours. Okay, but the potential for death lasts up to 5 weeks. So it can be deadly within a short time frame of 10 hours, all the way up to 5 weeks. Page 190, box 15.1 also has signs and symptoms of acute radiation syndrome. Be sure you look over that as well. Now, survival depends on what? Survival is going to depend on the dose of gamma radiation that the person encountered. Now, are we really going to be able to measure that? Probably not. Long-term effects of radiologic disasters are going to be illnesses such as leukemia, thyroid cancer, non-Hodgkin's lymphoma, genetic or teratogenic effects of infants. Okay. Then we have, continuing on with medical management for radiologic disasters, the first most immediate concern in any kind of radiologic disaster is going to be to limit your external and internal exposure to radiation. very first, most immediate concern. Limiting your external and internal exposure to radiation, okay? Your external exposure to radiation would be to stay indoors, close the windows, turn off the air conditioning because that pulls air from the outside in. Remove outer clothing before you enter the home. So you'd rather be safe than sorry. You're going to be naked outside and get in the house, okay? Doing this simple procedure of removing your clothing can eliminate 90% of external radioactive contamination. So it's super significant that you be sure and educate patients about this. You're going to shower first thing. You're going to seal the windows with duct tape. And you want to make sure that you have a radio or TV or something to be able to get the information about what's going on outside, okay? Lead is actually necessary to protect against gamma radiation. It's the only thing that's going to protect against gamma radiation. Now, many of us do not just have lead aprons laying around our house like you would receive when you get an x-ray, but that's just one of those things to know. All right, then we're also, as well as limiting external exposure to radiation, we're going to limit the internal exposure to radiation. So internal exposure is what's going in. So covering your mouth with a scarf or handkerchief, drinking only bottled water, eating only canned foods, anything, you're trying to eliminate any potential source of getting exposed to that radiation for yourself internally. All right, then your secondary, this is actually a secondary concern. I know it says primary concern at the top there, but this is actually a secondary concern, is to decrease the radiological organ damage. All right, so the ways you're going to do this is by using things such as potassium iodide, Prussian blue, DPTA. There are pharmacological considerations on page 191 in your book. 191. Yes, so be sure that you read through all of those to get a better idea. But we'll quickly go through this. So potassium iodide, it only protects the thyroid gland, okay? But it keeps the radioactive iodine from reaching the thyroid gland. It's used as soon as possible within the first 24 hours after exposure. If it doesn't work, I guess, if it reaches the thyroid glands, if the radioactive radiation reaches the thyroid gland, you increase your risk of thyroid cancer. Prussian blue here, we're going to use this to treat radioactive, radioactive cesium. So radioactive cesium. This Prussian blue, it treats internal contamination. It promotes the excretion of radioactive cesium. It's used 3 to 4 times a day for up to 150 days. Okay. Then moving on to our DPTA, it treats radioactive plutonium. It is an injectable salt or an inhalant spray. They use it to treat plutonium. And again, just be sure that you read through that section in the book. I know this seems like this is never going to happen to us. Why do we need to know this? And the thing is that obviously after 9/11, we know that anything is possible, unfortunately. So you do need to have this information available. All right, moving on to biologic disasters. So biologic disasters, the definition is pathogens or their toxins can cause harm to humans or other living species. Examples of biologic disasters would be things like the bubonic plague, the influenza outbreak. All right, 3 agents that are likely used to cause biologic disasters though: anthrax, botulism, and smallpox. And I know that we've had incidences recently where that's been a scare nationally as far as terrorism. All right, they pose threats because they're stable and easy to mass produce. It's easy to deliver to a large population. There's a very high risk of mortality, and it is likely to cause significant public fear, which of course it does. Okay. Then we've got anthrax, which is spore-forming bacterium, Bacillus anthracis. All right, it's inactive in the spore form and can be inhaled, ingested, or enter via the skin to become active. So it has multiple modes of transmission, which make it, I guess, good for terrorism or what have you, but very bad for the rest of us. Most cases are not infectious human to human. Standard precautions are sufficient when caring for an anthrax client because the contamination is not done human to human. Okay. Now I've got some pretty gross pictures to show you here. So here are examples of anthrax. This is anthrax actually to her eye over here. Okay. All right, so assessment of anthrax. Anthrax, the most serious form is inhalation. So if they have the anthrax developed for inhalation, that's going to be the most serious form. It is usually mistaken for a cold or flu initially, which causes a lot of problems because colds and flu are nothing you can do about it. Okay, so we're not really concerned with it, but we need to be concerned about anthrax. They will have severe respiratory distress resulting from being misdiagnosed, leading to death. And it's not necessarily the doctor's fault that they've been misdiagnosed. I mean, how common is it that we're going to say, oh yeah, this person's been exposed to anthrax? I mean, we're going to say the person has a cold or a flu or what have you. Ingestion, so because anthrax can also be ingested, this form is slightly less lethal. This person will have nausea, vomiting, diarrhea, abdominal pain. Again, pretty vague symptoms. And then we can have anthrax transmitted via the skin. So it is the least deadly form. It's the only one that can possibly be transmitted via direct contact. There are painless lesions, usually on the head, hands, and arms, that develop into these black centered blisters and then ulcerate out, just like the picture we just saw here. Okay. All right. Management for anthrax. So medical management, we're going to do cultures for diagnosis, blood cultures, stool cultures, wound cultures. It's fairly successful treatment with antibiotics such as Cipro or Levaquin. Treatment takes at least 4 weeks or longer for treatment, especially for an inhalant infection. And the vaccine, however, there is a vaccine that's been developed. However, only military personnel can receive the vaccine. It is 6 doses over 18-month time span. Okay. But there is a vaccine. All right, botulism. Botulism is a neurotoxin, Clostridium botulinum, anaerobic bacillus. All right, it's usually foodborne, botulism is. Can be transmitted via inhalation. It is not passed from person to person, so there is no human-to-human contact transmission with botulism. Okay. If it is used as a weapon, it is usually done in food or an aerosol. Now, here I've got some information for you on botulism poisoning. So it's a source of trouble with low-acid foods that are improperly canned. So I don't know how many of you do canning. I personally don't. I think it's a great thing. I wish I did, but I don't do any canning. But you have to be careful. So if you do canning, here are things you're going to look for. If the clear liquid turns milky, if the jars are cracked, loose or dented lids, swollen or dented cans, if there's just an off odor or weird smell to it, you're not going to eat what's been canned there. Okay. Prevention is going to be examining all canned foods before cooking, cook and reheat foods thoroughly, of course, and keep cooked foods hot or cold, whichever one needs to be. And then after eating, if they eat it and they do contract botulism, they're going to have double vision, droopy eyelids, trouble speaking, swallowing, breathing. All right, obviously untreated botulism can be fatal. And while you don't hear about it very often, this could very easily happen. I have some friends who can a lot. And I know that there are many people out there that do canning, and so this could very easily happen. All right, so assessment of botulism. Acetylcholine is blocked, resulting in paralysis of motor and autonomic nerves. Early signs for botulism are, I think your book says the 4 Ds, but I have 5 Ds listed here. So diplopia, and if you don't know these words, be sure you look them up. Diplopia, dysarthria, dysphonia, dysphagia, drooping of the eyes, and general muscle weakness. All right, the greatest danger obviously is going to be muscle paralysis, which is going to lead to respiratory muscle paralysis and could lead to death. All right, and respiratory weakness and difficulty, if this patient does survive, could persist for their whole lifetime. Okay. Okay, management, medical management, clinical rather than labs. Clinical diagnosis rather than laboratory diagnosis is used for diagnosis of botulism. All right, initially, they will take lab tests, but the results take too long to come back. So initially, they're looking at your clinical assessment to diagnose botulism. A lot of these patients require mechanical ventilation, sometimes for 2 to 3 months. Antitoxins are available. However, what you have to do is you have to do a pre-administration of the skin test, because there is a 9% hypersensitivity to the antitoxin, which doesn't seem like a lot, but it's pretty significant considering not that many people are going to be getting this vaccine to begin with. All right, there is a vaccine that's been developed. You get 3 shots over 3 months. However, again, is very high risk for hypersensitivity. And you also get yearly boosters. There is an increased risk with anaphylactic reactions. It is not a routine vaccine that's given because of this increased risk with the anaphylactic reaction to the botulism. Okay, move on over here to smallpox. So smallpox are highly contagious. It's the variola virus. The WHO, the World Health Organization, in 1980 claimed eradication. Used as a weapon, 30% would die, which would be about 2 billion people. All right, infection is spread via direct contact with the infected person, body fluids or contaminated objects containing the live virus, it is a live virus, and exposure to aerosol containing the virus. So if it's used for a weapon, this may be how it's going to be used, is through an aerosol. So although smallpox only survives for about 24 hours, if it infects one person, it is a huge public health threat. Okay, so that's pretty significant. So I'm going to show you some pictures here for smallpox. All right, looks incredibly uncomfortable. So your assessment for smallpox, very similar to chickenpox. They are asymptomatic for 7 to 14 days usually. Then they will get a temperature of 101 to 104, then a rash, fever subsides, then raises again until the rash resolves. It may be mistaken for chickenpox, however, they have an opposite outbreak and progression of the rash. So smallpox starts on the face and extends to the torso and the rest of the body. Chickenpox starts on the rest of the body and extends inward towards the torso and the face. Starts on the body and extremities and spreads up to the face. All right, the specimen must be grown within live cells and examined with an electron microscope. If a person were to come in with suspected smallpox, the CDC must be notified because, again, we already just said if just one person becomes infected, it is a public health threat. All right, table 15.1 on page 194 shows you the progression of the progression of smallpox. Be sure that you have glanced over that and know the time frames there for the smallpox. We're going to move on to still with the medical management, where isolation is required in a negative pressure room with very strict isolation precautions. Again, this highly contagious and considered a significant health threat, public health threat. The patient will be on airborne and droplet precautions because it can be spread through the respiratory secretions. Gloves must be worn at all times. You're going to autoclave everything. So you're going to put it in the little heat thing to autoclave it. You're also going to incinerate all linen and clothing. So it's that significant that we're going to burn everything. We're going to do mask, gown, eyewear, gloves. Close contact with this person. So if you have been in close contact with this person before or after they were diagnosed with smallpox, you will require vaccination and monitoring. So if the person was in close contact, we're going to monitor this person, the other person, for at least 17 days. All right, page 194 has more information on that as well. So be sure you read through that. Smallpox has no treatment. There's no magical treatment or cure for this, but medical management, we're going to give fluids, antipyretics, antibiotics for any secondary infections that may develop, antivirals. We may do the vaccine. It needs to be given within 3 days of exposure. So again, very significant to know who have you been in contact with if someone has been diagnosed with smallpox. It is contraindicated in a very small population, but that's going to be pregnant patients, patients who are immunosuppressed, and patients with eczema, actually. Now, nursing management is going to be vaccination, so being sure to vaccinate as needed, client teaching, and be sure, this is the wrong page number, but be sure to look on page 195, Nursing Guidelines 15.1, as well as the client teaching, caring for smallpox vaccine site. Okay, while it seems like you're not going to be doing this, this is something you may actually encounter. This is the most likely thing you may encounter, so be sure that you understand this fairly well, and you've read through those little sections in particular. Okay, now we cannot force this vaccine on anyone. However, if they are exposed and they choose not to get the vaccine, or they can't get it within the 3 days of exposure, they're going to be in isolation for at least 18 days. Okay, because remember, we're going to have to watch these people for 17 days for an outbreak. All right, moving on here to chemical disasters. All right, chemical disasters is a release of toxic man-made substances, industrial accidents, transport, terrorists. Examples are going to be nerve agents, cyanide, respiratory toxins, blistering agents, liquids that will vaporize without an odor or with familiar odors, so no one would recognize that smells really weird. We need to look into that. Okay, so maybe odors like garlic and onion usually is what they'll smell like. Indications of a chemical release. So what if you see these things, you need to be really concerned something's going on. Dead animals, birds, pets, fish, insects, dead and dying vegetation, an unexplained odor, and a fog-like or low-lying cloud. All right, here's some pictures for you. Okay. Very clear. These are all dead birds laying on the road. All right. Examples for your chemical disasters: nerve gas, cyanide, respiratory toxins, and blistering agents. So your nerve agent poisoning is the most toxic, right? So nerve agent poisoning, the most toxic. It inhibits the acetylcholinesterase, inactivating acetylcholine. Examples are going to be malathion, which is highly toxic to insects. It is actually okay for humans if it is used following the directions, because you will actually see this used in insecticides. Sarin, which was released in the Tokyo subway in 1995. So, again, something that's not that far off that you've never heard of it. This may occur. Assessment is going to be, they'll be symptomatic in seconds if it's with the vapor. So if they have been exposed via the vapor, they will be symptomatic within seconds, or maybe up to 18 hours before they're symptomatic if it is transmitted through skin or the dermal transmission. Liquid transmission, they will be symptomatic within minutes to hours. All right, death can occur within 10 minutes of inhalation, and there is no antidote for nerve agent poisoning. Okay. All I can think about when I talk about these things are shows. I know I've told you guys I like to watch those things like CSI, and they have this on quite a bit, and it's always kind of, one person in the lab who works with these things and has become jaded and decides they're going to go and spread these problems to society, and it's scary because it could very well happen. All right, signs of nerve agent poisoning is a muscarinic stimulation only. So involved with the memory, arousal, attention, bronchial small muscles, the bladder. So this is your mnemonic dumbbells. So you have diarrhea, urination, meiosis, that was that pupil constriction, bradycardia, bronchospasm, bronchorrhea, emesis, lacrimation, salivation, secretion, sweating. All right. So be sure to look over, oh, I gotta find it. Thought I had checked all my, oh, right here, page 196, signs and symptoms of nerve agent toxins, okay? Because they have dumbbells as well as nicotinic stimulation, so they have MTWHF. It's that Monday, Tuesday, Wednesday, Thursday, Friday, almost. So be sure you look over that. All right, medical management for nerve agent poisoning. We're going to use atropine sulfate. It counteracts the excess acetylcholine at the muscarinic sites. It does have to be administered every 5 to 10 minutes until hypersecretion ceases and breathing is adequate. Okay, so you're going to administer atropine sulfate every 5 to 10 minutes until hypersecretion ceases and breathing is adequate. We could also do, pralidoxime chloride, which reactivates the acetylcholinesterase. We could do Valium if there are possibly seizures, fresh air, oxygen via a bag valve mask. We're going to remove the clothing with gloves and seal it in a bag. Skin is washed with a solution containing bleach and water. All right, cyanide poisoning. So cyanide is a solid salt or volatile liquid causing death within minutes. It is used to execute prisoners often. The Nazis used cyanide poisoning to exterminate the Jews. It inhibits an enzyme needed for oxygen. Okay, oxygen metabolism. I didn't finish my sentence. It inhibits an enzyme needed for oxygen metabolism and cellular energy. It is colorless. It does have a faint odor of bitter almonds. Inhalation is the most deadly form. It can be ingested as well with lacing the foods, which is what you hear most often, like in my TV shows that I watch. Industrial chemicals that break down into cyanide containing byproducts, so things like that compound that's used to remove artificial fingernails. Okay, if that's ingested, that's bad. It can also be absorbed through the skin. So your assessment for cyanide poisoning, toxic effects to the heart and brain. Inhalation, if we have inhalation transmission, we will have tachycardia, tachypnea, but the patient does not appear to be cyanotic. We will have cardiac dysrhythmias, restlessness, dizziness, headaches, loss of consciousness sometimes, respiratory failure, hypotension. Now, if we are ingesting the cyanide poisoning, we'll have more vague symptoms, so things like nausea, weakness, dizziness. These will occur before the lethal signs and symptoms occur. Okay, medical management for cyanide. We're going to remove the clothing, place it in a sealed bag, wear protective garments, a respirator mask is necessary. Antidotes. There are some antidotes for this one. So you have your amyl nitrite, which is inhaled. You have sodium nitrite, which is given IV over 5 minutes. You have sodium thiosulfate, which is, also given IV. Most clients can be revived within 1 to 2 hours. Okay, so that's really important. All right, respiratory toxin poisoning. Chemical agents resulting in pulmonary edema when inhaled. There are 2 common respiratory toxins, and that is usually chlorine and phosgene. So chlorine is your a cleansing agent, and phosgene is a byproduct of freon, and it's also in insecticides. These things can very easily be obtained by terrorists. The assessment is going to be for chlorine. There'll be damage to the skin and eyes and nose, the mucous membranes. On wet skin, the dermal injury is similar to a frostbite. Okay, it is more hazardous in the gaseous form. They will have tearing, coughing, bronchospasms, laryngospasms. Phosgene breaks down alveolar tissue, impaired gas exchange. Okay, death can occur with inhaling these respiratory toxins. Management for respiratory toxins. Side effects are related to, I lost my place. Side effects are related to the amount, route, and length of chemical exposure. The most immediate measure is to take the client to the fresh air or higher ground, remove their clothing, double bag, wash the skin, rinse the eyes, remove contacts, clear, obviously if they've got contacts in. Drinking water or induced vomiting is not recommended. Now, why would this not be recommended? I mean, we want to get it out. We're not going to recommend doing this because there is a potential for secondary injury related to that coming back up the esophagus. We can injure again, as well as the potential for aspiration. All right, we may need to do mechanical ventilation if necessary. We're going to continue assessing stable clients for 48 hours to detect any delayed onset of signs and symptoms. And we may develop chronic bronchitis and emphysema even after recovery of these respiratory toxins. Hey, I'm trying to finish recording this last lecture. What's up? What are you doing? Okay. How's it been? Okay, good. I'm sorry. Well, Rue got your money over here. All right. Okay. Yep. All right. They're still with your parents. Okay. All right. Love you. Bye, hun. Okay. Sorry. Okay, so now we've got blistering agents. So blistering agents, or vesicants, are chemicals that damage the exposed skin and mucous membranes on contact. Vesicants can penetrate through fabric, so even if you're wearing clothing, that's not going to matter. They can be inhaled, which will damage the respiratory tissues, obviously. Examples include things like sulfur mustard or mustard gas, which damages the DNA of rapidly growing cells. This is also used as a chemo drug. And lewisite, which has actually never been used, but it is a blistering agent. So here's some pictures for you from mustard gas. Okay. Assessments for these blistering agents. The skin reaction, it is going to be a very immediate reaction, especially with sulfur mustard. Now, if you have lewisite, the reaction is actually going to occur hours later. You will have itchy red skin that becomes blistered like a sunburn. Blisters will be clear and yellow, have clear and yellow fluid in them. Eventually they are going to rupture. When they rupture, what do we have the potential for? Obviously, we have the potential for infection. Now, if we have inhalation, the cause inhalation of these agents, it will cause death within 24 hours. Long-term problems could be cancer, blood dyscrasias, and infertility or fetal abnormalities or anomalies. All right, medical management for these blistering agents. Decontamination within 1 to 2 minutes. The rescuer must be protected before starting this process, okay? We need to remove clothing and put it in a bag. We're going to wash the skin, use eye care. The only antidote is for lewisite, and it is this dimer-caprol. You must give it as soon as possible after exposure. You care for the skin similar to a burned wound management, which we just finished talking about. We're going to use mechanical ventilation if needed. Blood transfusions or Epigen or Procrit may be needed if the bone marrow function is suppressed. Okay, so that does it for disasters. Be sure that you read through chapter 15. Be sure you read the little boxes. They contain significant information that you will need to know. This will be on the final exam for me, and I only have 8 questions on the final exam. So I will have 2 from eyes, 2 from ears, 2 from burns, and 2 from disasters, which isn't a lot since there is a lot of information to give. But that's all that I have. So I think that's how I'll break it down. Thank you for listening. Let me know if you guys have any questions. I will be available via email this week and through the weekend. So just be sure and contact me if you have any questions. All right. Thanks. Bye.